And 91% of all dwellings in the national capital, Accra, are without private places of convenience. That's according to the Accra Metropolitan Assembly. The starting figures released by the Public Health Unit of the Accra Metropolitan Assembly also revealed that the situation had created a heavy dependence on public toilets and unapproved places for the disposal of human waste in the city. A total of 315 houses are also using the outlawed pan latrines, with some 79 homes also using pit latrines. Many Ghanaians across the country also do not have access to potable water, thereby fetching water from contaminated sources. Let's get some facts about the global outlook of water and sanitation hygiene.
0.2 billion people live without safely managed sanitation. That is more than half the global population. 673 million people still practice open defecation worldwide. Globally, at least 2 billion people use a drinking water source contaminated with feces. Inadequate sanitation is estimated to cause 432,000 diarrheal deaths every year and is a major factor in diseases such as intestinal worms and trachoma. Children under the age of 5 living in countries affected by protracted conflict are, on average, nearly 20 times more likely to die from diarrheal diseases caused by a lack of safe water, sanitation and hygiene than by direct violence, and that's according to the UNICEF 2019.
Well, Engineer Anthony Mensah is the Director of Sanitation at the Ministry of Sanitation and Water Resources, and he joins me in the studio. Good morning, sir, and welcome.
Good morning, madam.
So many Ghanaians do not have access to toilet facilities. How bad is the situation?
Thank you very much. That is true, and it is very, very bad. Ghana currently, access to improved sanitation is at 21%. And this is not good enough. At the end of the Millennium Development Goal era, which was December 2015, we were at 19%. And between that time and now, that is 2015 up to 2019, about 4 years down the line, we have only improved by 2%. Just 2 percentage points. So we still have a very long way to go. Open defecation, as at the end of 2015, that is December, was at 19%. As we speak now, there has been a slippage. We have gone down to 22%. It's not a good statistic that we can be proud of at all. It's not good.
So watching the documentary that we just played, do you feel that that's an accurate depiction of what's actually going on?
Yes. I wouldn't say it cuts across.
Of course.
But most of the premises, this kind of scenario is prevailing. And that is very, very unfortunate. We can do much better as a nation, especially looking at where Ghana is now in terms of economic development. We are now a middle income economic country. And we don't have any excuse not to do better. We definitely have to do much better than we are doing.
I mean, on our Clean Ghana campaigns, we have uncovered some very disturbing scenes relating to hygiene and sanitation. What will it take, very realistically, to be able to deal with some of these challenges?
We need a holistic kind of approach. One, we need to tackle our institutional arrangements. We need to reorganize our institutions. We have the Ministry of Sanitation and Water Resources in place now, which is about 2 years now old. Before the advent of the Ministry of Sanitation, we had Ministry of Local Government and Rural Development that had responsibility for sanitation, of course, oversight. The assemblies, that is the metropolitan, municipal and district assemblies, are primarily responsible, but the Ministry of Local Government had that oversight responsibility. Now we have a dedicated Ministry of Sanitation and Water Resources. The laws that are governing the local governance, that is the Local Governance Act 936, still has it that the assemblies are supposed to be or are responsible to the Ministry of Local Government and Rural Development. The assemblies that are responsible for sanitation on the ground, we only have the metropolitan assemblies, which are supposed to have waste management departments, which is a dedicated department within the assemblies responsible for sanitation delivery. The environmental health departments or units are supposed to be responsible for enforcement of bylaws. Now, if you go to the municipal assemblies, the Local Governance Act 936 does not prescribe the formation of waste management departments within the assemblies. That's the municipal and district assemblies. So if indeed sanitation is a major issue and it is so important to us as a nation, then we should have the right structures to deal with the situation. Now, when you get to the national level, the Ministry of Sanitation, which has that responsibility, is not represented on the ground. If you go to the assemblies, the Ministry of Sanitation does not have any representation at all. The assemblies are responsible to the Ministry of Local Government, and then also the Office of the Head of Local Government Service. So there is the need for that institutional reorganization, and that has been identified as a major deficiency. So the government has come out some few days ago, His Excellency the Vice President, during the CONIWAS conference in Ho, that's the Mole conference in Ho, he pronounced that government is going to set up a national sanitation authority. And this authority is supposed to be the agency that operates under the Ministry of Sanitation and Water Resources to have that responsibility of strategizing to implement the policies so developed by the ministry. So that is one major shift that is going to take place within the next few months or the year, so that we have that right institutional arrangement in place. And then also there is the need for clear-cut definition of roles and responsibilities, that this entity is responsible for this entity is responsible for that. If you look at sanitation, the infrastructure that we need for that subsector is huge. Yeah. It calls for huge capital outlay. It also calls for high technical expertise in terms of design and construction, supervision, and even the operation. If you look at the capacities of the assembly now, they don't have that capacity to be able to handle this complex kind of sub-area. So that institutional arrangement should be quickly reorganized so that we have the right institutions in place to perform the respective functions. Number two, we also need adequate resources, financial resources for that matter. We need to commit adequate financial resources to the sector for us to be able to make that inroads that we need to make within the shortest possible time, because our statistics don't speak well of us as a nation. Even though over the years there has been a lot of efforts in place. I can count of the Gamma Sanitation and Water Project, which is taking place in Accra here. Within, the project effectively started around 2015, but there were several challenges, and there was the need for retooling and reorganization. So beginning from 2018 up to 2019, as I speak now, the project target has been reached and overtoppled. The target for the project in terms of household toilet delivery was 19,000.
Okay.
As at the end of 2017, the total number of facilities built was less than 2,000.
Oh.
So there was a revolution that was put in place to accelerate the process of delivery. And between end of 2017 and now, the project has reached the target and gone beyond, as far as to 26,000 household toilet facilities.
So 7,000 over.
Exactly.
Okay.
And therefore, this project has been adjudged as a highly successful project by the World Bank, and then locally, the CONIWAS conference that was held last year, they awarded the Gamma project a plaque of indicating that the project has been the most impactful project during the last 10 years. So that is one major project or intervention that is going on. There are other complementary projects like the GASLIP, Greater Accra Sustainable Sanitation and Livelihoods Improvement Project.
Okay.
That is also seeking to put up household toilet facilities, also school sanitation facilities, and some other components which are sanitation related. There are also other interventions like we have a project under the Community Water and Sanitation Agency, which is funded by the World Bank. We call it Sustainable Rural Sanitation.
Okay.
And under that project, as many as about 7,000 toilet facilities or thereabout, even much more than that, 12,900 household toilet facilities are being implemented. And that one, the focus is on the rural setting. We also have the ministry directly also intervening by providing 2,000 household toilet facilities targeting the major urban cities. That is the Kumasi Metropolitan Assembly, Sekendite Takoradi, Tamale, and then Cape Coast. And because Gamma is benefiting Accra wasn't included in that. There are also other interventions like the UNICEF is partnering with government of Ghana to embark on rural sanitation programs. We call it rural sanitation model and strategy. Under that, about 40,000 household toilet facilities have been built over the past few years. And then also we have the urban sanitation component, which is also targeting urban centers, and specifically Sherman in the Gama area, and then also Tamale in the northern region. These are the two areas where the project is aiming at. And over the past couple of years, as many as 21,000 household toilet facilities have been put up. So over the past 3 years or so, as many as 102,652 household toilet facilities have been built.
Right.
And this is serving about 822,000 persons. That's right. So it means that a lot is going on. But if you look at the quantum of the problem, vis-a-vis the intervention and the results thereof,
it seems like a pin in the ocean.
Exactly, we still have a long way to go.
Right.
We need to do much more. There are some upcoming interventions also. I have to mention a feasibility study which has been earmarked for 12 urban centers across the country. And these centers cut across the whole nation. We have Wa in the Upper West region, Aguna Swedro in the Central region, Techiman in Bono East, Nkoko in the Eastern region, Hohoi in the Volta region, Bolga in the Upper East, Yendi in Northern region, Sunyani in Bono region, Konongo in Ashanti region, Koforidua in Eastern region, Takwa in the Western region, and then last but not least, Dambai in the Oti region.
Right, okay.
These urban centers are going to benefit from a feasibility study which will lead to the packaging of bankable projects. And then we will then implement these projects with a view to improving upon the sanitation situation of these urban centers.
Okay, well, we can't talk about sanitation without talking, of course, about potable water.
Yes.
So how do we bridge the gap between all of these things that we're doing, which seem like really fantastic inroads that we're making, but there's also the issue of water sources, yes, accessibility to clean water.
You are absolutely right. In fact, the Sustainable Development Goal 6 puts water and sanitation together. So you are not far from right by mentioning water if you are talking about sanitation, because you need water to improve upon sanitation and hygiene. And without water, all your efforts will amount to nothing. Of course, fortunately, the Ministry of Sanitation and Water Resources has that mandate, both water and sanitation, and a lot is going on. Of course, during the water decade, there was a lot of interventions in the area of water. Therefore, Ghana saw marked improvement in terms of water supply. And then beyond that, there have been also a sustenance in the water delivery. There are a lot of water projects that are ongoing, and a lot more are on stream coming. Because we were not coming to deal with water, and of course, I also don't have
all the
that
statistics.
mandate.
Okay.
Yes, I'm responsible for sanitation.
Okay,
but
enough.
I can mention some water projects. We have the Yendi water project. There is also the Navrongo water project, which has taken off. There are a lot more. I can't mention all of them, but there are quite a number of water projects, as many as about 10 or more. Some have already crossed the line of approval and implementation has started. Some are before cabinet. Some are also on their way to Parliament for approval. And all these are geared towards improving water supply. We also have some other water projects that the Community Water and Sanitation Agency is also embarking upon. I mentioned the Sustainable Sanitation Water Project being implemented by Community Water and Sanitation Agency with funding from the World Bank. There are rural water systems that are in there and that are all waiting for approval. Some have already taken off and they are under implementation.
Right. So staying on sanitation, obviously, we have sanitation management, and it seems to have been a bit of an issue over the past few years in terms of landfill sites, in terms of where we're dumping our waste, the recycling conversation, which seems to come up a lot as well. Where are we with that in terms of maybe possibly creating new landfill sites, also going into recycling? What's the ministry's focus when it comes to that?
Yes, we have in Ghana now engineered landfill facilities, only 4. We have them in Accra, Boom. We have one in Kumasi, Oti. We have one in Tamale, the northern region, and then the other one is in Sekendita Krade.
Okay.
Unfortunately, however, all these facilities, even though they were designed and constructed as engineered landfill facilities, they have not been operated as one.
Okay, when you say engineered landfill facilities, what do you mean, for the sake of our listeners?
Yes, what I mean is when we talk of landfill or landfilling, it's a process of putting waste into the land. And you can't just dig the ground and push the waste there. You need to take some precautionary measures to ensure that you don't contaminate underground water. And you also don't emit greenhouse gases into the atmosphere, methane specifically. So you put these measures in place to curb the impact of the waste within the land.
Okay.
So you, for example, you line the base of the cells that you put the waste in, and then you also put network of pipes in there. And then we call it drainage system. Within the pipe system, we also bury it in gravel. So that the leachate, which is the water that leaches out of the waste, will find its way into the pipe and then flow downstream to a dedicated location for treatment.
Okay.
So when you have this in place, and you also have network of pipe system to facilitate the emission of the gases that will develop or emanate from the waste once it starts to undergo decomposition. So the safeguards that you put in place to ensure that the waste disposal system is handled in a conducive manner such that it will not harm the environment. That's what we call engineered landfill facility. Okay. So apart from these 4, there are dump sites where these engineering measures were not incorporated into the design and construction. So the 4 that I've mentioned have not been operated the way they should, because apart from constructing in line with engineering principles, you also need to operate it as in the same manner. You put the waste in layers and then you need to cover it. And then you do that in layers, so that by the time you exhaust the entire airspace within the landfill facility, you have the people around, their health being safeguarded, and then also the environment generally being safeguarded. If you don't follow the husbandry in terms of the operation, then you are defeating the purpose of the design. And unfortunately, that's where we find ourselves now with regards to the 4 facilities I've mentioned. what the ministry is seeking to do, and if you listen to the budget presentation by the Honorable Minister for Finance some few days ago, he mentioned that these landfill facilities are going to be engineered. Going to be engineered in the sense that we are going to do what we were supposed to do, which we didn't do. And then also to prepare the facilities to function as engineered landfill facilities in terms of the operations. And then also going forward to look at providing new facilities in line with these principles, so we'll be able to sustain a very healthy and good environment.
Okay.
Specifically, we have another project that is coming up. We call it the GARID project.
Yes.
That's the Greater Accra Resilient and Integrated Development Project. This project has various components. Primarily, it is aiming at controlling flooding.
It's
Flood control.
$200 million.
$200 million, yes. But apart from the flooding that we are aiming to resolve, we also have other components within the project. One of them is sanitation, and the focus is on solid waste management.
Okay.
We are looking at repairing some of the dump sites within the Greater Accra area, and specifically one at Pantai. There's also another one at Abugoshi near ICJC.
Okay.
We are seeking to resolve or cap these facilities and make the area, those vicinities, habitable, so that people within those areas will not have their lives at risk as they are being subjected to now.
Right. Okay.
Apart from that, we are also seeking to build another landfill facility to supplement what we already have. The Pung one has suffered fire outbreak about 3-4 months ago. And the way it is, we can't continue to use it as a landfill facility. We need to re-engineer it and then prepare it for further disposal. Apart from the landfill, we also seeking to construct transfer stations, so that once the waste is collected, it will be sent to these centers and then transferred from there to the disposal site at a convenient time, probably in the night or so. So these are some of the interventions that are already ongoing, and similar interventions have also been earmarked, or I'm saying are being planned for the other cities. Kumasi, for instance, Sekandi Takra, Tema is part of the Gama area, Tamale, and all the other urban centers. So a lot is happening. Okay. And we need to cooperate with the agencies that are responsible to get these successfully implemented. Yes.
Okay, just before you go, quick question. Your budgetary allocation in the last budget, Minister of Finance, enough or not enough?
What I mentioned is not part of the ministry's mainstream budget. Okay. The mainstream budget is there, but this is a major monumental intervention project that the Ministry of Finance mentioned. Okay. There has been a collaborative discussion ongoing between our ministry, the Ministry of Sanitation, the Honorable Minister and his staff and the Deputy Ministers, and the Ministry of Finance. That's how come that it was captured in the budget and mentioned during the budget presentation. Okay. That's right.
Thank you very much for joining us this morning. We're very grateful for your time. I'm speaking to Engineer Anthony Mensah. He's the Director of Sanitation at the Ministry of Sanitation and Water Resources.